All right, this is section 4, which is talking about the characteristics of the community health worker, the purpose, functions, and core competencies. Now, the background for community health workers, the characteristics are to secure, preserve, and develop trust, to facilitate access to the community, to provide a necessary role the healthcare system is unable to meet. All of those go into the fact that you're basically able to help healthcare systems, community organizations, community partners, anybody who has clients or those who may be in need, to link them to barriers which could include health systems, providers, doctors' offices, clinics, things like that, or could also include other necessities that might be creating a barrier for them to get to resources. The working environment are going to be underprivileged communities with limited resources, limited access to health care, lack the means to pay for health care, non-English speaking, have cultural beliefs and behaviors different from dominant Western health care systems. Now, not all the time will we be working in underprivileged communities, but we have noticed that within those communities that do have limited resources and limited access to health care, that the mortality and morbidity rates for chronic diseases and other type of diseases and infections are higher, especially with non-English speaking. Unless someone has a translator in doctors' offices or health clinics, it's a lot harder for non-English speaking patients to receive care. This is the definition of a CHW defined, but basically what I want you to focus on is that you are a trusted member. You're going to serve as a liaison, link, or intermediary, and you're also to improve the quality and cultural competence of service. The last thing is that you're going to build individual and community capacity. So just focusing on those 4 different things, those are basically what we're going to be doing. And our last thing deals with our activities, which is going to be outreach, community education, informal counseling, social support, and advocacy. Those are our primary activities we're going to be doing, which goes to our big goal of building individual and community capacity, which in turn will improve the quality and cultural competency of service, all by us being that liaison that people can trust. My eraser just happened to not want to get rid of everything. Sorry. So, with the licensed health worker versus CHW, for a licensed health worker, they, of course, are licensed and they have a scope of practice. So you have a licensed diabetes educator. Their scope of practice is working with education of their clients about diabetes. As far as the CHW, we're educated in many different topics where we're able to serve different opportunities and responsibilities. They're subject to training and certification requirements. There may be continual education credits that they may have to get, or other certification requirements to basically keep their certification in whatever topic they have. They provide clinical services in any addition to CHW-like services. One thing about CHWs is we do not provide direct patient care. CHWs will accompany the medical personnel from the Portsmouth Health Department, but we do not provide direct patient care. And licensed health workers also may lack community and cultural connectivity, because just because they're a licensed diabetes educator or a licensed clinical social worker does not mean they know the area that they're working in, because they may not live there, may have never been there, they just got a job there. The CHWs, we're looking for CHWs who live, work, worship, or play within the Portsmouth area, so they already have those roots within this area and it would be easy to help people. The importance of the role differentiation, we want to avoid apprehension from healthcare professionals. Healthcare professionals, which is rightfully so, they may not all the time trust someone who's coming in to give education or support or advocate for their clients without knowing where they got their certification from, where they got their information from, and how they were trained. So with the CHWs, you want to clearly define that role of who we are and what we're going to be doing. So number 1, they don't think we're going to be doing more than what we're supposed to do. And number 2, we don't do more than what we're supposed to do. And also building and maintaining community trust is what defines our community health worker network. Roles for the CHW is basically to bridge for communities and healthcare systems, to provide accessible health education, assuring people get needed services, providing informal counseling and support, advocating for individuals and communities, and building capacity. And with providing informal counseling support, you'll also be dealing with case management, For advocating for individuals and communities and building capacity, you're going to be dealing with health fairs. And for providing accessible health education, you're going to be dealing with sites. Okay, I'm just going to erase this here before we go over to the next slide. All right. So, CHW core competencies include communication, health promotion and prevention, outreach and advocacy, service coordination, knowledge base, and professionalism. Now, when we speak about these are everything that they want a CHW to embody and the qualities that they want them to have in order to be successful in the Portsmouth area as well as within the state of Virginia. Because not only are we reflecting the help that we're giving in the Portsmouth area, but that transfers back to the state of Virginia and what type of help the CHWs are doing as a whole. CHW models, they have a member of care team, navigator, screening and health education provider, outreach enrollment worker, and organizer. What those different things is basically talking about the different responsibilities and areas that CHWs are able to work in. Either they're a member of the care team, they're probably offering support education. Either they're a navigator helping people to get to resources. They're a screening and health education provider. They're also providing education. They would do risk assessments. Outreach and enrollment worker, basically they're helping people deal with insurance. They're helping people through home visiting, words of that nature. And organizer, which is basically the advocate. And they may also do health education and promotion. What is our role? The VDH uses the blended model, so they want the CHWs to engage in all activities. Now, we do say that the CHWs, if you are engaged or if you would like to be engaged in more category more than another, that's okay. Say you would rather be a medical team member instead of outreach, or you work better with health education rather than organizing, that's fine. You can let us know that. We will have you in that area, and even though we may not always be able to give activities each month where you can volunteer directly in that area, we will also keep that in mind when learning how to schedule new sites, when learning about new opportunities, and also depending on who we would ask to do certain things. Just going back from a volunteer versus paid, the big things are when the CHWs are paid. We know that right now all of our CHWs are volunteer based. No one is compensated for anything. When we talked about reimbursement earlier, we were speaking about Medicaid reimbursement, things of that nature for the services that the CHWs offered. The paid CHWs, of course, have to go a little bit further. They also serve as mentors. They train recruited CHWs. They manage the network, and they promote the initiatives. Also, with the training, in addition to the training that you guys have to get, which is the CHW training, which are the selection of PowerPoints that we're going through now, you have the district VDH COP training and the medical reserve corps orientation, which you guys have scheduled in April with Ms. Teresa Young. Additional CHW requirements. We would like for people to live and work in the community, and I want to add also worship, and play. Because we know oftentimes people who worship as well as people who play or have fun in Portsmouth may also have those connective roots. Serve as a lay health worker, not a health professional. We give no clinical care. Background check with fingerprint. That will be completed with Miss Tanya Weaver from HR. The VDH basic training, which is what we're going through right now. Traveling within the community to different health fairs, different sites and events. Potential home visiting has been something that we're talked about, but it's not something that's going to happen right now because we want to make sure we've ensured the safety of our CHWs, the safety of our clients, and also dealing with insurance liability and getting everything together. And also speaking to groups and or individuals that'll primarily come through your health fairs. CHWs should not give a diagnosis, give medications, prescribe medications, do everything for someone, give false information, accept payment, or do something beyond your training. CHWs are not allowed to accept payment of any kind. We're not allowed to do everything for someone. When it comes to case management, of course, we want to help everyone get into all the resources that they need. But we realize when we have a client load of 25, we cannot give one person all of our time and all of our resources. We have to make sure we're reaching everybody, because I know some needs may be urgent than others, but that's why we also want to categorize our clients in terms of importance of their needs. Say one person who has their electricity and water cut off versus one person who would just like to get a refrigerator versus another person who just wants to get in a diabetes self-management program or pre-diabetes program. All those are very important, but when you think about the necessary necessities that may affect oxygen tanks as well as medications and things like that, you have to prioritize. The MRC, which is the Medical Reserve Corps, is the orientation that you're going to be going to, like I said, with Ms. Terry Young. It is a dedicated volunteer force to support the community in a public health emergency. If we were to have a public health emergency, a catastrophe to happen in the city of Portsmouth, which we hope we never will, the Medical Reserve Corps are a group of volunteers that are healthcare professionals, doctors, nurses, psychologists, psychiatrists, even veterinarians, to go out and assist at that site. We have 31 local MRC units in the state of Virginia, and CHW volunteers must complete that MRC application process. You guys have already been through step 1 with finishing the volunteer application on virginiamrc.org. The MRC application process, you're filling out the application form, you're doing the MRC HIPAA and liability policy acknowledgement form, and you're also registered in the Virginia Volunteer Health System. When you're registered in the Virginia Volunteer Health System, you may be contacted by Ms. Young in concerning other events and things like that dealing with the Medical Reserve Corps, because as a CHW, you fall under the umbrella of the MRC. As a volunteer for the MRC, you're provided with risk management protection, you're ensured public safety, and you're provided an identification badge. As we know, identification badges are very, very important as we're going into different sites and different places. We want to be able to assert ourselves and also show that we're a part of an entity. We don't want to just walk in and say, hey, we're CHWs, we're here to work, we're here to take your client's confidential information. They're definitely not going to go along with that. All right, and this has concluded the Section 4, Characteristics of Community Health Worker.